So today's talk is called Chiropractic and Science. And before I get into the talk, I just want to ask you guys, if you went back, say, 30 years, what did you hear about chiropractic 30 years ago? Hey, Steve, come on in. Good to see you. What did you hear about chiropractic 30 years ago? What are some of the things people used to say?
They were bone crushers.
Yeah.
Bone crushers, okay. What else?
Oh, nothing good.
Yeah, I mean, did you ever hear something like, wow, chiropractic is really scientific?
No.
Mm-mm.
No. But you probably heard that about pretty much about anything that happened in, like, if you went to a medical office, you'd assume that everything was scientific.
Right.
You'd assume that it was. But chiropractic was always considered not even on the fringes of science, really outside of science. So in the last 15 to 20 years, there's been an explosion of research in everything. And one of the things I really like about the age that we live in now, or the last 15 years, is that everything is being looked at. Everything's being researched. And because of that, there's a lot of research now on chiropractic adjustments and spinal manipulation, and a lot of research is coming out now about that. So that's what this is about. This talk came about over 15 years of collecting chiropractic research. And I used to have a radio show, and I covered most of these articles, maybe all of them, on my radio show. So we're going to talk about what is it about, what research has been done, what do we know about chiropractic and how it works. So the first journal article ever published on chiropractic was published in 1921 in the Medical Times Journal. It's a very famous study called the Windsor Autopsies. And Henry Windsor was a medical doctor from Philadelphia, the University of Pennsylvania, and what he saw was people came to him that had been to chiropractors that had gotten great results. And he wanted to see if there was a relationship between the health of the spine and any diseased organs that he found. So at the University of Pennsylvania, he dissected 75 human and 22 cat cadavers and found a total of 221 diseased organs in the humans and the cats. And he said there's nearly 100% correlation between minor curves of the spine and diseased organs. So he would look at a spine, he'd find a minor curve, and he'd find that the nerve supply that came out of this, that went to the organs, anytime you get a curvature like this, there's always a relationship between a curvature and organ malfunction, where where those organs were supplied by those nerves. Of course, here is a chart of the autonomic nervous system to show how the organs are hardwired into the spine. So here's some of the correlations he found. He found that in almost every person and every animal, that the level of the spine that was degenerated correlated with the diseased organs. So if he found heart problems, he found all 20 cases had the upper 5 thoracics involved, like right up here. Lungs, of all 26 cases, they all had the upper thoracics involved. Stomach, all 9 stomach diseases had mid-thoracic involved. Gallbladder, mid-thoracic. Kidney disease, lower thoracics. Prostate and bladder, of 8 cases, 7 were from the upper lumbar and 1 from the lower thoracic. Pancreatic disease, all 5 cases of pancreatic disease had mid-thoracic area, T5 to T9. Liver disease, also mid-thoracic area. He said it was rare to find an organ diseased which was not supplied by the same sympathetic nerves as the vertebra in the curve. And then many of the organs showed acute disease, while the deformed vertebrae were older in nature and proved that the curvature preceded the disease. In other words, the vertebrae were degenerated, but there's an acute disease in the organ, which meant that the spine there's problems in the spine, which was that had happened before, which was causing the organ disease. And here's what he found: disease appeared to precede old age, and then to cause it. So he found the spine becomes stiff and old age follows. Therefore, we can say a man is as old as his spine. Mm-hmm. And this is back in the 20s. Have you ever heard of that study? No, of course not. I hadn't heard of it either. Here's some recent studies proving the validity of chiropractic. At the University of Iowa study on Medicare patients, here's what they found. They looked at Medicare patients under chiropractic care. They found they had fewer functional limitations, less difficulty engaging in activities such as lifting and walking, lower number of doctor's visits and hospitalizations. And they concluded in the study at the University of Iowa that chiropractic had a protective effect, safeguarding them against physical deterioration. Now, does that mean, and I'm in the Medicare, group right now. I'm in that category. Does that mean we're never going to get old? I wish it meant that. Yeah. But what it means is that we can grow old much more gracefully and without all the problems. Now, just as an aside, this has nothing to do with so much. It doesn't have much to do with science, but I do animal chiropractic, and the vet that trained me told me, he said, if you take an animal and you adjust that animal periodically, that animal will 30% longer, and that 30% that animal will be healthy. So that's what we're seeing here. Now, if you look at chiropractic and pregnancy, here's another interesting study. 115 pregnant women that experienced pain in their back and pelvic region had not engaged in chiropractic care the previous 3 months. So they were not restricted from participation. 1 week into treatment, 52% noticed a reduction in pain. 1 month in treatment, 70%. If you look at 6 months, 90% noticed a reduction in pain. 2 other studies on chiropractic and pregnancy revealed that pregnant women under chiropractic care had half the delivery time compared to women with no chiropractic. So what does this mean? What does this say about the spine, nervous system, organs, pregnancy, delivery? What does this mean?
Well, it keeps everything more of a tip-top shape to be able to do what needs to function properly. So it just keeps them in better alignment and shape, and everything's working better.
Yeah, and for a baby, for a woman to have a baby, the uterus needs a nerve supply in order
Absolutely.
To contract.
Yep.
Okay, if that nerve supply is being interfered with, it's not going to work as well. I'm not saying it's not going to work. Mm-hmm. It's not going to work as well. Now, here's the Annals of Internal Medicine. There's 192 patients with back-related leg pain. Half were given chiropractic care with home exercises and advice. Half were given home exercises only with advice. Chiropractic patients got 20 visits over 12 weeks. So at 12 weeks, the chiropractic group had less back pain, less disability, better overall improvement in patient satisfaction. At 1 year, the patients who received chiropractic maintained their overall improvement and satisfaction. So this is out of a blue blood medical journal, Annals of Internal Medicine. 2 recent studies, one in Canada, and this is out of the Journal of Manipulative and Physiological Therapeutics. The other one's out of a journal called Biomed Central. One of these studies was in Canada, one in Tennessee, showed that on average, chiropractic care was 40% less costly than medical care, and patients were much more satisfied. Now, here's another study from Dartmouth University on the safety of chiropractic for older people, found that of people over 66 who received chiropractic care, 76% had a lower rate of injury within 7 days of treatment compared to those who saw a medical doctor. Here's another study in the Archives of Physical Medicine and Rehabilitation. 40 men were diagnosed with degenerative disc disease. Half were treated with chiropractic, half with a fake adjustment. Okay, results from the people who received a single adjustment reported less pain, had increased spinal mobility, had better hip flexion, had significant measurable increase in height. So what about chiropractic in the workplace? This is really interesting. This is 2 studies out of the Journal of Occupational Environmental Medicine. I believe these studies were done in like 2016, somewhere around there. First of all, 17% of U.S. workers miss work because of back issues, musculoskeletal issues. Chiropractic care, for the companies that offered chiropractic care at the workplace, it showed improvement in both pain and functional status, lowering of health costs. Workers had used fewer drugs, had less physician visits, reduced worker absenteeism, and employee productivity increased. So you think that every manufacturing plant would have a chiropractor there. You know, why wouldn't it, based on this study? Well, I had an interesting conversation with, she was a human resources person, and I think she's also the nurse at is a company here in town. And she told me that one of the reasons they won't do this is because chiropractors are considered primary healthcare providers, is that if somebody gets injured and they go to a medical doctor, a chiropractor, an osteopath, what happens is that has to be reported to the government, to OSHA. So what do you think happens then?
Well, if they get too many reports, they're going to be investigated.
Absolutely. That's exactly what happens. The government sticks its long, scaly arm into the business, and bad things happen. And so if they go to a nurse, and the nurse treats them with pharmaceuticals or whatever, they don't have to report it. So that's one of the reasons this doesn't happen at companies, okay? Because they don't want the government getting involved in their business. So what about cervical disc herniation and neck pain radiating into the arm? Something that I've seen quite a bit. I see it all the time, actually. So they looked at 50 patients with confirmed cervical disc herniation who were treated with chiropractic. Now, how would you confirm cervical disc herniation?
How would you what?
How would you confirm that? How would you know somebody had a herniated cervical?
X-rays.
X-ray will not show a disc.
MRI?
Or
It
MRI.
has to be an MRI. MRI is the only way I know. Maybe CT scan, but MRI. So they confirmed disc herniation. Patients in this study had neck pain with moderate to severe arm pain. Patients were giving 2 to 4 visits a week until pain-free. So that's about the schedule that I put people on, okay? At 2 weeks of care, 55% were improved. At 4 weeks of care, almost 70 or 69% were significantly improved. At 3 months of care, 85.7 or 86% were significantly improved. They said spinal manipulative therapy was 3 times superior to published studies of patients receiving a cervical nerve block with steroids. Now, here's what I find interesting about this study. It took 3 months to get people to this point right here. This didn't happen overnight. I think over half the people getting improved after 2 weeks is pretty good. I think that's really good, I think. But they needed 3 months of care at least 2 to 4 visits a week to get to 85.7%. So they needed pretty intense care for a while to get to that point. That didn't happen with just a few visits. Now, here's one of the more interesting things that and we are starting to get into what I consider the really interesting studies in chiropractic. Changes in biochemical markers of pain perception and stress response. In other words, what happens with the biochemistry of the body after you adjust somebody? We know the pain gets better, and we're going to talk in a minute why pain gets better and how that works. But in this study, they looked at 3 biochemicals known to have physiological effects on pain: neurotensin, oxytocin, and cortisol. By the way, what does oxytocin do in a pregnant woman? What's that hormone do?
To give them more energy and handle pain.
Well, it actually, oxytocin, oxytocin in a pregnant woman causes the uterus to start contracting, so they deliver, okay, which is interesting. So cortisol, where's cortisol produced in the human body? Anybody know?
The adrenal gland?
Yeah.
Adrenal glands, right.
Yeah.
And what does it do?
Give
What are
it-
some of the things it does?
Gives you energy.
Yeah, I was gonna
Yeah.
say, gives you energy.
It gives you energy by mobilizing sugar, okay? Okay. It also reduces inflammation. It also stimulates the nervous system or the immune system, okay? Does a lot of things, all right? So they had 30 subjects divided into 3 groups. They gave them cervical, thoracic adjustments, and no adjustments. And they measured these 3 things, okay? All 3 chemicals elevated with cervical adjustments, okay? Neurotensin and oxytocin elevated with thoracic adjustments, but not cortisol. So what they found is definite biochemical effects of being adjusted by chiropractic. Now, here's Medical Science Monitor, February 15th, 2016. It says this study looked at what happens when an individual loses a cervical curve. Okay, so we're looking at this right. Here's normal curve, reverse curve, loss of curve right here, normal, loss curve. So they're saying what happens physiologically when you go from this to this, and I see this all the time in practice. Okay, causes, here's what happens. It causes a disruptive biomechanics triggering degenerative process, which is basically a fancy way of saying they're getting osteoarthritis in their neck, okay? It causes neck pain, upper thoracic pain, shoulder pain, headaches, poor health-related quality of life. Look at this number 4. Loss of cervical curve also causes a decrease in blood flow to the brain due to changes in the vertebral artery. So what do you think happens there? What do you think would happen over a long period of time?
Well, your brain's not gonna function real well, probably.
Yeah, so it's not going to get as much oxygen.
And so that's probably why older people start having problems, because their discs by then, if they haven't been going to chiropractic treatment, things are all out of alignment. So not that that's the whole cause, but it would cause a lot of...
It could, yeah. And it actually, if the neck is, if the vertebral artery is being stretched and pinched, yeah, they're not going to get the blood supply and the oxygen to the brain, okay? That's why I stress neck exercises so much, because home neck exercises fix that, usually. Not always, but usually, okay?
They probably help a lot.
Help a lot, yeah. So I try and take people from here to there. Now that takes time, because when you're in this state here, the ligaments start to shorten, and you know it's like trying to stretch a rubber band over time. It just takes time to do that. So this is the vertebral artery is coming right along here. So the vertebral artery is being stretched backwards, and what happens if you take a banana, which is shaped like this, and you move it the other way? Breaks the banana. Yeah. So here's Journal of American Medical Association. May 18th, 2018. This is a study conducted on 3 military bases. Results of this study is they recommended spinal manipulative therapy for low back pain. Chiropractic care resulted in a lessening of both low back pain intensity and disability. They found it had a low risk of harm. Patients were happy, and they perceived improvement in active duty military personnel. Do you know how hard it was to get chiropractic on military bases? That was like the last stronghold of the AMA was in the military. And it took a lot to finally get this to happen.
So almost every university football team's got a chiropractor on staff.
The pros for sure.
Oh, the pros, that's right,
Yeah.
they do.
Pros
yeah.
for sure. And a lot of the university players go to chiropractors. Yeah, definitely. How about chiropractic and migraines? This is a journal called Complementary Therapies in Medicine, which is actually a really pretty good journal. They have good studies in there. The 3 groups of migraine sufferers were divided into 3 groups. One group received chiropractic adjustment and drugs. One group received a sham adjustment and drugs. One group received drugs only. Okay? 6-month study. After 6 months, the results of the study were the manipulation plus drug group were able to reduce their drugs by 80%, their migraines were reduced by 97%, and their functional disability by 100%. The meds plus sham manipulation, fake manipulation, they reduced their drugs by 68%, their migraines are reduced by 17%, and they have 33% reduction in functional disability. The meds-only group had no reduction in medication after 6 months, had only a 1% reduction in migraine headaches, and a 0 reduction in functional disability. Now, here's a question I want to ask you. Why was the fake adjustment group, why did they do so well?
That's what I was wondering.
Okay, so
What
that's
is what is a fake adjustment? What's
okay. It's so it's where they set up. They may set up on somebody and just do this.
that? Okay.
Okay, or they
Pretend to give them a treatment.
pretend to
they
give them a
don't.
treatment, adjustment, and they don't get one. So why would the fake adjustment people
Is
still
it-
get pretty decent results? Yeah, part of
That's
it's placebo effect.
Yeah.
Absolutely. What else? There's one other reason I think is really interesting.
Well, they're still getting movement put into their spine a little bit.
A little bit, okay, that could certainly be a possibility. Here's what I was thinking, is just being touched by another person has therapeutic effect.
That's true.
You know, and
That's
so
true.
they were being touched by a healthcare provider in a way that was they felt was going to help them, and that has therapeutic effect in and of itself. So here's another great study. This is such a good study. This is done in Japan. They use PET scans. They would adjust somebody, and then they do a PET, positron emission tomography of the brain, and see what happens in the brain when somebody's adjusted. What they found out is that the cingulate cortex, the frontal cortex, the activity increased. So people that were adjusted had an increase in frontal cortex function. In the cerebellum, which is back here, which regulates emotions and coordination, increased activity. Okay? The somatosensory cortex, which is the midbrain, which perceives pain, by the way, reduced function, reduced activity. The salivary amylase, which is an enzyme which increases with stress, significantly reduced. So I want to ask you a question. So the somatosensory cortex is a part of the brain called the midbrain, and it perceives pain. It's part of the brain called the thalamus. So what does this tell you about how chiropractic affects pain? Anybody?
Reduces it.
Reduces it, but where is the reduction? In other words,
In
Is
the
it your brain?
nerves?
Yes.
What did you say?
In your brain.
Well, I was going to say the brain, but I was thinking the nerves or
So
something.
we perceive pain.
Okay.
Pain is perceived in the brain.
Okay.
Okay.
That
So
makes sense.
it's in a part of the brain called the periaqueductal gray in the thalamus. So what's happening is that when somebody gets adjusted and their pain gets better, even though they actually feel the pain down there, it's the brain that's reducing the pain. So what's happening is that chiropractic is really brain therapy. It's affecting brain function.
So it must improve hormones and stuff to move in the brain too, like exercise does, because Jack Nebelsick's 96 years old and he exercises 30 minutes every day, and he's as sharp as a tack.
Yeah, exercise improves circulation, which improves brain function. Sure. So here's the bottom line of this study, and this is, I'll show you another one here in a minute, is that chiropractic improves brain function. Period. Now, if you look at Heidi Habit, she's a PhD and a chiropractor who's published 50 papers on how chiropractic care affects the central nervous system. And here's what she found, is that spinal subluxations cause abnormal feedback to the brain, which causes abnormal brain function and abnormal feedback to the body. She said this causes poor control of the spine and body, leading to pain and loss of function, which affects balance, reaction, depth perception, increased muscle fatigue, and loss of strength in legs. So she said spinal subluxations really cause the dysfunction is in the brain. And she says, according to Dr. Habit, the most interesting thing that has come from her research is that chiropractic care, adjusting the spine to restore spinal function, actually changes the way the brain functions. This is why I think it's so important to adjust autistic kids. Because you're going to change the way they're, and I have autistic kids as patients. In fact, I have one right now, and his mother says he's doing a lot better. Now, I haven't fixed his autism, but a whole lot of things are better. And I haven't done any kind of really nutritional thing with him at all. It's all been just adjustments. I'm sure you know what I'm talking about, right? So Dr. Habit found that a single chiropractic adjustment positively alters all sorts of processing in the brain, including how the brain controls muscles, the strength of the muscles, muscle fatigue, and what's called sensor-motor integration, the capability of the central nervous system to integrate different sources of stimuli and parallelly to transform such inputs into motor actions. Now, what this is basically saying is it helps coordination. So an athlete, based on her research, athlete would be pretty darn smart to get chiropractic. And most of them do. You probably don't know this, but in the last Olympics, and I think the one before that, the head doctor of all the doctors on the Olympic team was a chiropractor. He came and spoke to our state convention a while back. He was a chiropractor, head doctor. Why? Because the athletes demand chiropractic care. One other thing I want to talk about tonight before I let you go is the concept of NNT, number needed to treat and number needed to harm. Now, I'm going to talk about pharmaceuticals here. This is a very, very, very well-known concept in the pharmaceutical industry and in medicine in general. The NNT is a number of people that have to be treated with a particular therapy to get one individual well or to prevent one occurrence. So in other words, how many people do you have to give a drug to before one benefits? Or how many people have to have a surgical procedure before one benefits? That's what they're talking about here. The NNH is how many people need to be treated before one person is harmed. Okay? NNT, number needed to treat, NNH, number needed to harm. So let's look at some of them. This is all online. There's a website called thennt.com, and that's where I got this information. If you look at statin drugs, only 1 in 103 benefit, over 5 years.
I
So,
believe that.
yeah, 103 people have to take statins for 5 years before one benefits. So, that's a lot of wasted money, okay? Antibiotics for upper respiratory infection. None were held for infection, 1 in 6 for cough. Coronary bypass for preventing death in 10 years, 1 in 25 helped. Aspirin to prevent heart attack, 1 in 2,000 helped. Okay.
Boy, and they really push that.
Oh, they do.
Yeah, they do. But if you look, this is all out there. The NNT of chiropractic care is estimated to be between 1.8 and 2.4. So we have a very low NNT, which is what you want. Okay, I'm going to skip that. Okay, so I promised you that I would talk about the prostate tonight, and I am. I actually thought I was going to do another talk, so I inserted in that talk, and I realized, hey, that talk is on September 29th. It's not tonight. But since I promised you, I'm going to talk about that. So,
Do you have time?
I gotta be somewhere in 4 minutes.
oh, you do? Well, come to this talk on September 29th, and I'll
Yeah.
talk about it then,
All right.
for sure. But I made sure I inserted